Okay, so I'm going to knock on the door. I'm going to introduce myself and who I am. And I'm going to wash my hands. I'm going to identify my patient with two identifiers, which is their name and their date of birth. Next, I'm going to test my patient. I'm going to provide privacy, actually, with the door, close the door or get the curtain. Next, I'm going to, oh my God. Next, I'm going to check level of consciousness to my patient by asking them who they are, where they're at, and the time. While they give me those answers, I'm going to inspect for and assess for quality of speech and appropriateness of speech. And I'm also going to inspect general posture and general hygiene. Next, I'm going to inspect the head for any bumps, lesions, hair distributions, and any signs of parasites. And then I'll move on to cranial nerve number 2, which is the optic nerve, which I'm going to test with the confrontation test, which I'm going to have my patient go ahead and cover one eye. And I'm going to have them looking at my nose. And I'm going to have you identify each number on each quadrant here. Okay, and I'm going to have you do that on the same thing on the other eye. Go ahead and cover one eye, look at my nose, identify each number in each quadrant. Okay, good. And then next, I'm going to inspect the nose. I'm going to inspect for any deviations of the shape, size, if it's either side. I'm going to check for any discharge, and I'm going to check nose patency. So I'm going to ask my patient to go ahead and cover one nostril with one finger. Go ahead and sniff, and then do the same thing on the other side. Go ahead and sniff. All right, and then I'm going to check cranial nerve number 8, which is the ears. With a light, I'm going to check around the ear, check for any discharge, any serum, any lesions. I'm going to check the external canal too for any discharge, any lesions. And I'm going to do that same thing on the other ear for comparison. And then I'm going to check for hearing, and I'm going to use a finger rub test. So I'm going to have my patient close their eyes, and I'm going to gently rub my fingers, and they're going to tell me what side they hear it on. And I'm going to do the same thing on the other ears. Next, I'm going to move on to cranial nerve number 3, 4, and 6, which is the eyes. I'm going to look at both eyes and compare them. I'm going to check for any redness or any discharge. Next, I'm going to check for the pupil size, if they're equal, round, reactive to light. I will have a light, and I'm going to see if they are reactive to light, if they constrict and dilate on each eye to check for comparison. And then I'm also going to check for accommodation. So I'm going to ask my patient to go ahead and look at an object. Can you go look at that lamp? And then go ahead and look at my finger. Good. And then next, I'm going to also test my patient with the 6 cardinal fields of gaze. So I'm going to ask my patient to follow my finger in 6 different directions. Okay, and that is parallel right there. Next, I'm going to check cranial nerve number 9, which is the swallowing test. So I'm going to have my patient swallow. Now I'm going to check cranial nerve number 10, which is the vagus, which I'm going to have my patient go ahead and open their mouth. And while they're opening their mouth, I'm going to inspect the mouth for any serum mucous membranes, any general dentition, and then also the vagus, the cranial nerve number 10. I'm going to check to have my patient say ah, and I'm going to check for that uvula to symmetrically rise with phonation. Next, we're going to check cranial nerve number 12, which I'm going to have my patient go ahead and stick out their tongue, and I'm going to check if that tongue comes out midline and symmetrically. Next, I'm going to test cranial nerve number 10, which is the shoulder shrug test. So I'm going to gently put my hands on their shoulders, and they're going to shrug up. And I'm going to push down. And I'm going to test my patient's resistance. So I'm going to gently put my hand on their face, and they're going to turn. I'm going to push. They're going to resist. Go ahead, resist. Okay. And then next, I'm going to go ahead and check for any lymph nodes. So I'm going to gently palpate. I'm going to palpate right in front of the ears, which is the pre-ocular, and then right behind the ears, which is the post-ocular. I'm gonna go gently right behind that head, and it's gonna be the occipital. And then I'm gently gonna palpate in the corner of the jaw, which is tonsillars. And moving on to the jawline, which is the submandibular. Underneath that chin, which is the submental. Then I'm gonna go ahead and palpate on the neck here. I'm gonna inspect the neck first for any lesions, redness, swellingness. I'm gonna gently palpate that's anterior cervical, posterior cervical. And then that supraclavicle, I will be palpating on the skin, right by that clavicle, which is the supraclavicular, right on that clavicle there. Next, I will be testing range of motion of the neck. So I'm going to have my patient go ahead and flex their neck and extend their neck, and go ahead and turn your neck like this. Now, go ahead and do a full rotation of the head. Okay. And then next, I will be inspecting the thorax area. So I'm going to compare the AP with the transverse diameters. I'm also going to inspect for any deviations of shape of the thorax. I will have my patient with their shirt off inspecting this. I will also be assessing respiratory rhythm, respiratory rate, their depth, their accessory muscles, and also any presence of cough too. And then next, I'm going to have my patient go ahead and just turn around. Turn. No, sit on your knees so I can sit on your knees. Sit on your knees. I'm going to check the spine alignment. I'm going to assess the spine, so I'm going to check if the spine's aligned. And I'm also going to check for chest expansion. So I'm going to take my thumbs and I'm going to place them right on the T9. I'm going to shape them butterfly. And I'm going to ask my patient to go ahead and breathe in and out. Big breaths. Breathe in and out. And I'm going to check for those thumbs to expand symmetrically. And then next, I'm going to percuss for severe vertical angle and tenderness, okay? So I'm going to gently have my hand here, and I'm going to just percuss on the spine there for any tenderness. Next, I'm going to test for any tactile dermatitis. I'm going to have the palm of my hands here, and I'm gently going to tap them on my patient's back. When my patient feels me tapping with my palms, they are going to say 99. They are going to say 99. They are going to say 99.
99.
Okay? And then next, once I'm done assessing and percussing, I am going to osculate for lung sounds. So I'm going to use the diaphragm on my belt. And I'm going to look at 8 different places. Breathe in. And breathe out. And I will be doing this on the skin. 8 different places. Breathe in, breathe out. And I will be going slower to giving my patient time to breathe in. And then I will also be osculating underneath the armpit, which is the axillary area for lung sounds, 2 times on each side. Right underneath the armpit there. Okay. Go ahead and turn around. Next, go ahead and sit down. Next, I'm going to check for coronary arteries. I'm going to gently palpate each the coronoid on each side, one at a time. Palpate on each side, one at a time. And then next, I'm going to osculate for any brewings, any brutes, using the bell side of my stethoscope. And I'm going to ask my patient to breathe out and hold their breath. And I'm going to listen for a couple of beats. And I'm going to do the same thing on the other side. I'm going to have my patient breathe out and hold their breath. And just listen for a couple of beats. Okay. Next, I'm going to osculate the anterior side for any lung sounds and breathing sounds. So I'm going to use the diaphragm on the skin for breathing and lung sounds 8 times. Breathe in, breathe out. Next, I will be osculating heart sounds. So on my right side, it's going to be the aortic valve, right on the second intercostal space. On that left side, it's going to be the pulmonic. On that second intercostal space, right below it on the third intercostal space, it's going to be Erb's point. Then, right underneath it, the fourth intercostal space is going to be the tricuspid valve. And then right underneath that tricuspid valve is going to be the mitral valve on that fifth intercostal space. Okay, and that will be on, I will be osculating on that skin. After I am done assessing the anterior and the posterior, I'm going to have my patient go ahead and lay down, and I'm going to assess the abdomen. While I'm assessing the abdomen, I'm first going to inspect the abdomen for the shape, deviations of shape, any the contour of it. Then I'm going to then osculate in 4 different quadrants of the abdomen. I'm going to start on the right side of the belly and work myself around down towards the left side. And I'm going to lips cross right down the belly button. And I'm going to gently listen with my diaphragm on the skin. Every time I listen to a sound, I'm going to move up to the next quadrant. Every time I listen, moving on to the next one. All the way down to that left side. If I do not hear anything, I'm going to listen for 5 minutes. Once I'm done osculating, I'm going to gently palpate the abdomen for any tenderness, any lumps, bumps, and I'm going to start from the lower right quadrant and work myself up. And then I'm going to end at the lower left quadrant. Okay, once I am done assessing the abdomen, we are going to move on and assess the upper extremities. So I'm going to palpate each arm for the temperature of the skin, check for any edema, swellingness, tenderness, check the skin for any lesions, the roughness and smoothness of the skin, and I will be doing that on both arms for comparison. Next, I'm going to do the range of motion. So I'm going to have my patient go ahead and flex that arm, go ahead and extend, adduct, and then abduct. And I will do that same with the other arm. Next, I'm going to be testing for strength. So I'm going to have my patient go ahead and hold on to my fingers. I'm going to have you pull and then push. Pull and push. Good. Next, I'm going to check for pulses. So I'm actually going to check for that radial pulse. That's going to be right here. I'm going to check, and then check for that brachial pulse, which is going to be right here. Right here. You probably can't see, but okay. And then I'm going to test for reflexes. So the first reflex I'm going to do is a brachial. So that's going to be right here. And I'm gently going to just tap on it. I should see that jerk. The next reflex I'm going to do is that bicep reflex, and I want to see this arm jerk when I hit on the bicep area, which is going to be right here. And I want to see that jerk. And then next I'm going to do the tricep reflex, which when the patient's lying down, I'm going to have my patient go ahead and put their arm right over their chest, and I'm gently just going to hit that tricep, and I want to see that arm jerk. I will show you on this side. I want to hit right here, right on that tricep, and I want to see that arm jerk when they're laying down. Okay, and then I'm going to now check for capillary refills. I'm going to gently pinch the finger, and I'm going to see for that color change in the fingernails, and I will do that on every finger, on each hand for comparison. Okay. Next, I'm going to move down to the lower extremities of the legs. Here, I'm going to gently palpate on each leg, and I'm going to check for temperature. I'm going to check for any tenderness, any lesions, any edema, same as the arms, any edema on the legs. And then I'm going to do that on both, and then I'm going to check for pulses. First pulse I'm going to check is for the popliteal pulse, which is right underneath that knee. I'm going to take my fingers and I'm going to lightly palpate underneath the knee and check for that pulse. Just going to be right here. Check. And then the next pulse I'm going to do is the dorsalis pulse, right here on top of the foot. I'm going to use 2 fingers, and it's just going to be right on top of that foot there, and I will do it on each side. The next pulse I'm going to do is going to be in the inner side of the ankle here, right by the Achilles by the tendon, Achilles and tendon, but right inside that ankle. I'm going to check, and I'm going to check on both sides here. Next, I'm going to check reflexes. The first reflex I'm going to do is the one on the knee, right, a little bit right under the patella. I'm going to hit, and I'm watching for that leg to jerk up. The next one, I'm going to do the Achilles, and it's right behind that tendon right here. And I'm going to gently just tap over it, and I want that foot to jerk. And then the last reflex I want to check is the plantar reflex. Go ahead and come this way so you can see. I'm going to gently, with my sharp side of my reflex hammer, I'm just gently going to start from the heel, and then I'm going to go up, and I want to see those toes curl. So I'm going to start from the heel and then work myself up. And I want to see those toes curl. Once I'm done assessing that part, I'm going to check for range of motion at the bottom. So I'm going to have my patient go ahead and adduct their leg, adduct, and then go ahead and abduct, and go ahead and flex, extend, and then I'm going to test for strength on the lower extremities. So I'm going to put my hands on that dorsal, and they're going to go ahead and push towards them. And then I'm going to place them right on the plantar, just how the plantar reflex was. I'm going to go ahead and place my hands on the plantar, and they're going to push, dorsy down, dorsy flexing down, there we go. Plantar flexion down, and then dorsy up. Okay, and then once I am finished assessing my patient, which I am now done, you can sit down. I'm going to make sure my patient has their call light. I'm going to make sure my patient is comfortable. I'm going to make sure my patient has all their personal belongings near them. And then I will be washing my hands when I'm done. And I'll be closing the door for them.